I'm David T. W. Chiu, MD. My field of interest is in plastic surgery. Very much interested in the research of nerve regeneration, nerve reconstruction, and my clinical practice encompasses several areas, notably hand surgery, microsurgery, peripheral nerve surgery, and cosmetic surgery. I began with wanting to be a doctor, a simple physician then who can make a child feel better whenever the child would be brought to see him for any type of problem. But with that simple intention, I gradually get to know more about the content of what medicine's all about and learn about the diversity of the specialties among all form of specialties in medical and surgical world. There are several events that actually culminating in my final decision, but the most impactful event, I have to say, it's due to one discussion with my mentor, my first mentor in surgery, Dr. Jerome P. Webster, who was patiently cultivating my interest in plastic surgery. And for whatever reason, at the time I was not the most receptive to it. However, he did show me what the real meaning of being a plastic surgeon is all about, and more importantly, the meaning of being a physician. I think that is a very important moment. We cannot erase injury, we cannot erase the scar of trauma. However, if we try hard enough, we allow the patient to minimize those deformities, somehow regain the ability to work as an individual in our society and build a life. The result of this life could be perfect. I still can feel the chill. The funny thing is, as stubborn as a young man, I didn't quite tell him that. But that practically drilled the seed of being a plastic surgeon in me. I have the great fortune to travel quite a bit. My early education took me to 3 different continents: Hong Kong in Asia, London in Europe, and St. Louis in Missouri, America. I went to medical school at the College of Physicians and Surgeons of Columbia University. That was a wonderful 4 years of education that I enjoyed immensely. Following that, I did my general surgery training at a wonderful institution, Washington University Medical Center, particularly Barnes Hospital, followed by a residency in plastic surgery, again at Columbia Presbyterian Medical Center. Following that, I did a fellowship with Dr. Robert Beasley at NYU. And upon my completion, he invited me to join him in his practice and join the faculty of the Institute of Reconstructive Plastic Surgery of the surgery department. And I worked there for 9 years, and I count that as part of my postgraduate education. One of my achievements that I found it pleasing to recall is the validation of the concept of nerve conduit, which I actually coined the term and introduced that concept into a clinical application. I continue to use that model experimentally to continue to investigate the mechanism of nerve regeneration, first in a cellular level and now in a molecular level. I like to challenge dogmas. Like when I was a resident, I was taught how to do skin graft. I learned it well. However, I don't like the fact that skin graft is thin. If you put a skin graft on the nose, the skin graft may take. However, you have an indentation there and also have hyperpigmentation. I never liked that. I challenged the dogma by introducing a scanty amount of fat under the skin graft. And to my present surprise, it took well. Of course, I am extremely meticulous in performing skin graft. I don't let technique become a hindrance. And with time, I discovered that you can even add it all the way up to at this stage, like as thick as 4 millimeters, still have wonderful result. In fact, I'm happy to share this with my colleagues. That helps a lot in terms of improving the efficacy of skin grafting. If you ask me what allowed me to tackle some of the difficult problems in surgery or perform some of the seemingly impossible maneuver, I would say is simply being focused. I like to leave my legacy to all who is interested in learning, who is interested in helping people, and who will gain happiness and peace through dedicating our God-given ability to serve our fellow man. One lesson I like to pass on to my student in the future is be diligent to learn as much as you can. Be a good scholar. Be thorough in your study. However, never be a slave to a book. Always have a mind prepared to challenge whatever seemingly unreasonable. Doesn't matter how conventional that doctrine has been. My family molded me. My parents, to begin with, always believed that there's something special in me, as every parent would do to their children. However, that is very, very important in molding my own personality. And I have a supporting family. My wife is my rock, and I never have to worry anything whenever she's around. And my children are always challenging to both my wife and I, and they keep us young. At the end of my journey, I would like to be remembered as a good person, an honorable man, and I would like to be able to face my Creator and tell Him that thank you for giving me all the grace and gift, and I have worked very hard to make the best use of it. I like to encourage my fellow man to be optimistic. I like to encourage my fellow man to look at the beautiful side of life. Try your very best to make the world a better world every day you live. With that spirit, I think we will make the world a paradise.